Welcome. This 15-minute training from the Washington State Department of Health gives an overview of our newly published genetic referral guides. These guides can help primary care teams identify and refer patients who may be at risk for common hereditary conditions, including hereditary forms of cancer, heart disease, high cholesterol, and liver disease. Your care team already has the skills to use these guides effectively. There are no prerequisites for using the guides in your clinical practice. This training focuses on how to use them in practice, but it isn't meant to be prescriptive. We want you and your care team to find what works for you, your patients, and your workflows. If you want more details on one of the conditions, each guide includes gene reviews, a clinical reference page for genetic conditions. We are also available for personalized support. Reach out if you have questions or need help connecting with a genetic provider or resource. You can email us at genetics@doh.wa.gov. Let's start with the clinical scenario that you may be familiar with. You receive a message from a patient. They have learned that their paternal aunt was recently diagnosed with breast cancer. And they also learned their paternal grandfather had passed away from metastatic prostate cancer. Combined, you already sense a pattern, and the guide confirms it. You can see that breast cancer before 50 is an early onset red flag, and that metastatic prostate cancer is listed under rare cancers. Within a couple of minutes, you've responded to the patient and initiated a referral to a genetic provider. That's the goal: prevention through early identification and clear action. This patient was identified early, but that is not always the case. Most of the time, genetic and hereditary conditions go undetected until after someone is diagnosed with cancer or other health problems. That is a major missed opportunity to prevent disease or catch it early. Primary care teams face barriers and challenges. There's often uncertainty about who to refer, when to refer, and where to send patients with possible genetic risk factors. But you are well positioned to use these simplified guides. Using them aligns with the work you're already doing. You likely already collect health histories and talk with patients about risk and prevention. Many genetic conditions are subtypes of common chronic conditions, and you already care for these conditions every day. And in our healthcare system, primary care is the gateway to specialty services. You are already the connection point, and these guides are designed to remove the guesswork. We do want to be clear about what these guides are and, importantly, what the guides are not. These guides are simple, actionable, one-page tools for genetic referrals. They are not meant to be comprehensive or diagnostic. We designed them to be quick references in busy primary care settings. They can be laminated or saved, but they do not replace detailed risk assessments or genetic diagnoses. You can leave that to the genetic counselors. These guides just flag patients for potential referral. Each guide lists clinical red flags, such as personal or family history patterns, lab results, age at diagnosis, or physical signs that may indicate hereditary risk. These are observable patterns your team can spot without specialized genetics training. Each guide also includes clear referral pathway, with a directory of genetics clinics and telehealth options for patients in rural areas. Trusted resources are included for both providers and patients, like evidence-based guidelines for your team and plain language materials you can share directly with patients. Now, what these guides are not. They are not a replacement for a genetic provider or their informed consent process. Decisions about genetic testing involve a detailed conversation about benefits, limitations, and alternatives. That conversation happens with a genetic counselor and not in a busy primary care setting. These guides also are not an endorsement or recommendation for or against genetic testing for any individual patient. That decision is made between the patient and the genetic counselor. And meeting the criteria in our guides does not guarantee insurance coverage. Some patients who meet the criteria may face coverage challenges. Others who don't fully meet our criteria may still qualify if a genetic counselor makes a strong case. Our guides were co-developed with clinical genetic providers and informed by professional guidelines. They identify patients who could benefit from genetic services. The genetic counselor takes it from there, including helping patients navigate insurance, financial assistance, and payment options. In short, these guides try to answer one question: does this patient meet the minimum criteria to see a genetic counselor? We created the guides with the entire team in mind. We know providers are very busy and have a lot to get to in their short time with their patients. In creating these guides, we focused on simplicity. We don't think you need to be an MD, DO, NP, or a PA to engage with these tools. We envision registered nurses and other clinical support staff and roles being able to use these guides. These may also be useful in settings where teams regularly collect patients' personal and family health history or perform risk assessments, like mammography clinics, gastroenterology practices, cardiology, or OBGYN. These guides can be used during any type of visit, like annual exams, chronic disease management, or when a new diagnosis comes up. Reach for a guide when you notice a patient with concerns about their family history, or if a patient has multiple family members with the same or related condition, or if you see early onset of disease in a patient or their relative, or maybe a patient getting a related health screen, or even when a patient asks why questions that aren't easily explained by other health risk factors like lifestyle, environment, or life experiences. You can take these 3 simple steps. Feel free to check the most relevant guide's genetic red flag section. Then document the red flag using your health institution's workflow, such as problem list flag. And finally, refer. Please note that your health institution may have genetics departments. If you're unsure about this, you can use the statewide provider directory, which is included in every guide. With this simple framework, let's walk through how this could look with a real example, using the Hereditary Breast and Ovarian Cancer Syndrome, or HBOC guide, which can be found on our program's healthcare provider webpage. Each guide has a brief background section on who the guide is for, the condition, and why early identification matters. There's also important notes too, so pay attention to those. We included this background section because we wanted a provider who may not have any context on these genetic conditions or the guides to have enough information to engage with the tool. So this next section, patients to consider for genetic referral. This is where you would likely spend about 30 seconds to a couple minutes cross-referencing information with the patient's personal or family health history. So you can see its specific genetic red flags seen in HBOC. This is a highly simplified version of the multi-page professional guidelines available for these conditions. If your patient checks any of the following boxes, they can consider meeting with a genetic provider. You'll notice in some of the other guides, there is and or logic, meaning symptoms and lab findings, for example. Pay close attention to these specific words in each of the guides. For all of the guides, we encourage shared decision-making with the patient. Not every patient wants to understand genetic risk, and that is totally okay. We certainly defer to your best clinical judgment for any clinical scenario. Now let's go back to that case you saw earlier. Your patient has a paternal aunt with breast cancer diagnosed at 45. She checks this first box here. This is an HBOC-related cancer and is especially suspicious if breast cancer is before 50. This particular patient also has a rare cancer in their family, with their paternal grandfather having metastatic prostate cancer. Based on this family health history alone, the patient can consider genetic referral. If time allows, we definitely encourage collecting a more thorough family health history, really on all patients, but for this particular patient, you can move on to the recommended next steps, where you can find clinics that offer the services the patient is eligible for. We also offer suggested risk communication, so you're better able to start these conversations with patients. And if you want to learn more or the patient would like more information, there are trusted resources at the bottom of the page. The entire process from opening the guide to placing the referral takes just a few minutes. Of course, this will vary depending on your familiarity with the guides or how many guides you have to review, but the goal is quick identification and referral, so patients can access detailed genetic risk assessments if they'd like. This process works across all the guides and can be integrated at multiple points in your workflow. Let me walk through 4 real-world examples. During triage, a nurse learns that the patient has multiple relatives with colon and uterine cancer. He checks the Lynch syndrome guide, adds the concern to the patient's problem list, and discusses the option of genetic referral with the patient. During chart review, a provider sees that the patient has a parent and grandparent with high cholesterol. She checks the FH guide, discusses and documents the potential of FH risk. The patient is interested, and she initiates a genetic referral. During rooming, a medical assistant learns that the patient's father passed away suddenly from a heart condition. She checks the HCM guide, flags the chart for provider review, which ultimately identifies other family members with heart disease and arrhythmia. They discuss a genetic referral. A patient you have seen for diabetes management requests an appointment after learning their mother was diagnosed with hemochromatosis. The provider checks the guide, which clarifies that the patient may benefit or be considered for a genetic appointment. The provider also considers lab markers like iron studies and discusses a genetic referral option. Notice that in each of these scenarios, the guide supports quick decision making. The care team checks for red flags, documents, and refers. We understand talking about risk can be complex, especially if there isn't a specific risk number available. You may be worried about what to say or about upsetting the patient. We don't expect primary care teams to consistently keep up to date on genetic risk models. At this early stage of risk identification, it's best to keep it simple and reassuring. That's why every guide includes suggested language to help start these conversations. Here's an example you can use or adapt. We noticed a pattern in your health history that sometimes runs in families. This isn't a diagnosis, but it may be worth exploring with a genetic specialist who can help you understand your personal and family risk and what you can do about it. If this is something you're interested in, I can place a referral to a genetic clinic. It's better to connect patients with genetic services than miss an opportunity for early intervention. With that, we'll wrap up. You can find the full set of genetic referral guides and all of our program resources on our main webpage, linked here. From here, you can navigate to the healthcare provider section. For more information on the topics and genetic conditions covered in this training, we encourage you and your team to review these resources and references. If you would like more personalized support, feel free to send us an email or schedule a time to meet with us under Optional Support section on the Healthcare Provider webpage. If you have feedback, feel free to use this QR code, also accessible on our main webpage. Thank you for watching this training.